I'm going to take questions. I'm certain you'll have a number of questions. I'm just going to get straight into the surveillance report, and then we can get into questions and probably answer a lot of that. So bear with me here. You guys see the surveillance report? Okay. So let's just start out with where we are with the number of cases we're seeing. We've seen that increase since the holidays that we were talking about. We haven't seen a real rapid escalation so far in January. That's encouraging, and that's what we want to continue to see. I'd really like to see these numbers come down in the future, but it's encouraging that we're not seeing the type of rise that we had in early mid-November. We're going to continue to work hard. It's really important that I think a big part of this is what the community is doing and the hard work that's going in terms of continuing to take seriously social distancing, continuing to stay home when you're sick, continuing to wear face coverings, especially in indoor public places, especially when social distancing is difficult. Those are the things that are going to help us continue to bend the curve, continue to see fewer cases. As you know, when we're seeing fewer cases, that takes pressure off the hospital. We tend to see fewer hospitalizations, and that will, down the road, lead to fewer deaths. Our 7-day average of percent positive has dipped below 10%. There's some complexity to this. I think it's encouraging that we're not seeing that continue to rise, and the daily numbers have stabilized over what we were seeing over the recent period of time. What I do want to point out is over the past week to 10 days, one of the things that's driving this decrease is that we've folded in some test results that are coming from a pretty major surveillance testing effort that's going on in Big Sky. There's hundreds and thousands of tests, hundreds and thousands of tests going on in Big Sky, that it's sort of separate and distinct from our overall testing system here in the Valley and the symptomatic testing system that we have. We think it's important to count all those. When you do count those tests, we're seeing a higher number of negative tests. That's okay. That's a good thing. It's a complete picture. The bit of a concern I have is that testing, that surveillance testing, is happening in a fairly specific and limited geographic area. It's not spread over the whole county. When you take out that surveillance testing, our daily rolling 7-day average with this is right around 8.5%, 8.4, 8.5, 8.6%. When you take out the surveillance testing that's happening in Big Sky, that increases to about 14%, still above the 10% mark. Again, it's not to say one of these figures is invalid. It's just a matter of making sure that we're paying attention to it. We're understanding the complexity of it. Part of the point of it is we want to make sure we have enough testing going on. It is complex because that testing tends to be concentrated. Some of that surveillance testing is pretty concentrated in Big Sky. Again, we'll see in a minute. We're continuing to see pretty good turnaround times on testing in the county. I've seen that anecdotally, and we're seeing that in the numbers as well. You'll see that here. The median time from specimen collection to when we're getting test results is about 2 days. We've had one day where it popped above that, but generally speaking, test results are coming back in a pretty timely way, which helps our contact tracing and helps us get to people, get them isolated and get their close contacts quarantined in a way that helps us limit the spread of the disease. Again, we want to see these bars in the 1 and 2 day category higher than the rest. You'll recall, and there have been weeks in the autumn when we had pretty high bars in the number of days in the 4, 5, and 6 category. That's not the case anymore. That's really good. That is an indication that when we're getting people in for testing, because they have symptoms, because they're a close contact, we're getting those test results back in a timely way. That the relative evening out of the number of cases has also allowed us to do our contact tracing, taking a little bit of pressure off it. Although I would note, we are still seeing a fairly significant number of cases. When you're seeing an average of 71 cases a day, that's significant. There was a time during this pandemic that would have been, pretty unbelievable, and it's become more of a normal thing as we've built up capacity, as we built staffing, as we figured out technology resources to help us with it. We've dealt with it. You can see again the area in the orange shaded is incomplete data. This is the onset date of symptoms of cases that we have detected. Seems to be a bit of an uptick here after the holidays. Again, that shouldn't be shocking to anybody, as the holidays those numbers were probably somewhat artificially lower because people were not going in for testing. Some of the healthcare clinics were closed a significant number of days, and there was less lab activity going on. Again, you can break it down by age. We continue to see fairly significant increases in the younger age groups, especially the people in their 20s. And you can read for yourself. You can see we're seeing that continued rise. It's just steeper. We're seeing more cases in people in their 20s. Just starting again this term at MSU. I wouldn't make too much of the percent change. We're really seeing a pretty significant difference because MSU is coming back into session. We're continuing to see cases at MSU as we did last year. That shouldn't be unexpected. And then we're a really significant number of K-12 schools, as well as we've got multiple long-term care facilities that have cases, including some with multiple cases, and we have staff working, in an ongoing basis on those. Okay, I am done with that presentation. I am ready for your questions, and I'm sure you got a few. It's been an eventful week. So, who's got a question?
Hey, Matt, it's Freddie with the Chronicle. How you doing?
I'm good. How are you?
Good. Thanks for asking. Hey, I wanted to get your reaction to the Attorney General's order yesterday for the county's attorney's office to dismiss its case against the Rock and R Bar, and what does that do to enforcement here?
Freddie, that's litigation. It's still ongoing litigation. I'm going to let the attorneys work that out. I will say a couple things. My intention is to stay focused on the work that's happening in Gallatin County to slow the spread of the disease and to distribute the vaccine safely, quickly, and transparently. Under Montana law, local boards of health are not only granted, but they're duty bound to take measures to protect the public health. The Gallatin City County Board of Health is doing that, and my job is to implement those decisions. I work for the Board of Health, and I work for the people of Gallatin County, not the Attorney General. So we're focused on getting the vaccine administered and limiting the spread of the virus that continues to cause hospitalizations and deaths here in Gallatin County, in our community and throughout the state. That's about the extent of what I can say about it right now. Again, it's ongoing litigation, and we need to be pretty careful about what we say publicly. Other questions?
Hey, Matt, it's Perrin from the Chronicles.
Hi, Perrin. Perrin?
You,
Hey, Perrin, you're going on and off mute, and I'm not hearing you right now.
We can try to jump to someone else can jump in while maybe Perrin tries to deal with the technical issues.
Yeah, just you want to skip to another question, and we'll come back to you, Perrin, as soon as we get that squared away.
Hey, Matt, in the meantime, Cody from KBCK. How you doing?
Good.
Hey, just talking on vaccine doses, how are we looking right now? Especially, we've been talking a lot about phase 1B leading up until this. You already answered a couple of my other questions already with other things, but what do we have doses right now in the county? How many, and what are we looking for like next week and so forth?
So yesterday, our team administered over 550 doses at a point of dispensing we had at the fairgrounds that was focused on people eligible under 1A, phase 1A. We still have some vaccine to deliver under 1A, but we're not going to let that hold us back from moving on to 1B. In order to move on to 1B, we need vaccine allocation, and we want to be also respectful of the pace and the timing that that Governor Gianforte's administration is setting on that. Our hope is to have a vaccine to begin 1B perhaps as soon as the week of January 24th, not actually on January 24th, but the week of January 24th. We're planning for that, we're staffing for that, but again, that's really dependent on vaccine allocation and coordination at the state level. Here's some important things I want everyone to know, and it's really important. I hope you'll help us get this message out there. First of all, no one's missing out on anything. We're not yet taking signups for 1B. We're going to be very careful and pretty deliberate about how we do that, so that we give as fair of an opportunity to everybody to get signed up as possible. When that happens, we're going to be communicating on our website. We'll be communicating through the newspaper. We'll be communicating with local television news. And we're working on ways to allow people to get notifications of that process on their phones in real time when it happens. Nobody is signing up for 1B at the moment. So I want to make sure that everybody understands when we get vaccine, we're building the machine to be able to administer that vaccine. And when we are ready to take those reservations, and that's what it's going to be. It's going to be reservations. It's not going to be an all call, everyone show up at a certain place. We're going to do this in an orderly way. We're going to really communicate in a comprehensive way to give as many people out there a chance to get those vaccines. To ensure transparency and broad community input on this, as we've talked about, we have formed a COVID-19 vaccine distribution task force, which it's more than just the health department. It's more than just county government or city government. It really includes representatives from community organizations, from healthcare providers, from businesses and government, to help us prioritize vaccine distribution and help us make sure we're doing it in a way that gives access and builds understanding, and that we're not forgetting groups. That group met, I think it was this week, I guess. I'm losing track, recently, because we know we're not going to have enough vaccine to satisfy demand. We need everyone to understand that. We have in category 1B, the governor's changes to category 1B moved the number of people who are eligible for the vaccine from about 90,000 to about 250,000 people in Montana. We're currently getting an allocation in Gallatin County of, when we're in a good week, we're getting 500 vaccines. We hope that increases. Statewide, the state really only has, depending, about 6,000 or 7,000 doses of vaccine to spread around to all 56 counties. We think that's going to increase in the weeks ahead as we get through the allocations that are needed to satisfy the need at the long-term care facilities, the nursing homes, and the assisted living facilities. As we get to that point in time, we know that there's going to be demand, and we asked our task force to really sit down with us and really develop those 1B priorities. When we get to that point, the consensus of the group is to honor the governor's protocol and to make sure that we're fitting within the priorities that are being set at the state level. We think it's important we work as a team on that. And so our first, and the governor's protocol really talks about emphasizing people who are most at risk, and that tends to be people on an elderly population. When we start this, and this is really feedback that we got from the distribution task force, we're going to start with those who are over the age of 80, because we're not going to have enough vaccine to satisfy everybody. The task force felt it was very important to not only honor the governor and the state health department's system and prioritization guidelines, but that we work hard to get it to people who are most at risk. And that's going to, at the outset, there's going to be people who are over the age of 80, and it's going to include, as the governor's plan does, American Indians and other people of color who are at greater risk due to environmental and other economic factors, who tend to be more affected by this pandemic. When we do that, we are going to be communicating broadly in forums that people that age category tend to use. And we're going to be working with community partners to build the ability, especially for the elderly, to connect to that system and to get those shots. We want to make sure that people don't feel left out of that process, but we also need them to understand that not everybody is going to be able to get it in the first week. We expect our allocation is not going to grow rapidly. We would expect that we'll probably have an allocation similar to what we've been getting, which is in the hundreds and not the thousands. And when we do that, we're going to, again, be focusing on those initial target areas of people who are over the age of 80, American Indians, and other people of color who are at greater risk. As we have more vaccine, as we build supply, and as we're able to satisfy the need of people over 80, I fully expect that age category to come down, and this to be able to give shots to people who are 75 and older and people who are 80 and older. We know that there's been a lot of communication about everybody who's eligible in 1B. We just want people to understand that these are really difficult decisions. The task force that came together really thought about this a lot, and we really feel like, you know, for the most part, the people who have been dying of this disease are the oldest among us, are people that are over the age of 70. And as you go up in age, in the age bracket, people are more at risk. We also know that American Indian populations and people of color have been disproportionately affected by the pandemic. And so as the governor's protocol suggests, we're going to be honoring that as well. We're also going to be open to healthcare providers, as they have access to vaccine, to be able to provide vaccine to people with really severe underlying health conditions. But I want to caution, we don't have enough vaccine to come close to providing vaccine to everybody with an underlying health condition. It really is going to be pretty limited in the initial weeks of this. We really are going to be focused on people of that over 80 age category, and then bringing it down after that. We're not yet taking appointments for 1B. I know, just in my own personal going through life, that I want people to understand they're not missing out on the opportunity. But we are going to announce that in a comprehensive way. We're going to do it in a variety of settings, and we're going to give a lot of people a chance to sign up when we do get to that point. We want people to not be too disappointed if we get to that point and those appointments get taken pretty quickly, because we expect that to happen. More vaccine will be behind that. We will continue to allow people to sign up for those points of dispensing. We also hope that our partner organizations will be able to obtain vaccine, will be able to provide vaccine in healthcare settings, perhaps in educational settings, and those other kinds of places. Do you have any other was that your question, Freddie?
That was me
this
time.
Follow-ups on that?
Well, more or less.
Sorry.
Yeah, sorry. And I apologize. My camera has ceased to be working. So fought the good fight. But pods, kind of going off of that, do we know when more will open up possibly in the near future? I know the Gallatin County Fairgrounds one has been going strong.
Yeah, we're planning to continue that process. I would hope if we get the vaccine allocation before the end of the month. Again, we're not announcing a date. Once we announce, we're not going to announce a date before we know we have vaccine allocation, and we're going to be careful about announcing a date in a narrow way. We really want this to be transparent and a lot of people to be able to hear about it all at once. We're also working on ways to be able to push that information to people. They'll be able to sign up and get notifications on their phone when we have vaccine available and when those appointments are available. We don't know yet, but we've built the machine. It's a matter of getting the vaccine to be able to feed into the machine and then be able to open up the appointments. That's what we're waiting for right now.
I'll just add to, that system that Matt's talking about receiving notifications. We should have some news for you guys on that early next week. So just keep your eye out for that.
Cool. Thank you.
Other question, Perrin, did you get your thing worked out? Maybe not.
Hey, Matt, I kind of have a question if Perrin's not, or if anybody else is not going to ask a question. I was wondering, we're talking about American Indian and people of color. Are within those categories, are we looking at like income brackets or people of color with more underlying health conditions or anything like that? Or is it just persons of color who are included in that phase?
We're going to be working with partner organizations and getting that communication out there, Freddie. We're not going to be asking for income verification. We're really looking for people who are more at risk. I want also to understand, like, those designations are come down from the national and the state level and are also directed. We want to make sure that there are counties like Bighorn County and regional areas. And I think part of that is focused on sort of at the state level. We are going to make those vaccines available as the governor recommends. We're not probably going to be able to slice and dice it. I don't know how we can practically slice and dice it based on income or based on those other, but there's one thing we can do is reach out to partner organizations, reach out to folks at MSU and those kinds of organizations to try and get connection to those folks. We'll be looking in West Yellowstone. We have a fairly sizable Latino community here in Gallatin County, and the Latino community has been disproportionately affected across the country. We'll be working with organizations that way as well. Other questions?
I have a question. It's Caitlin from Yellowstone Public Radio. I am wondering if the news broke this morning from the Washington Post and several state governors that there's no Federal Reserve of second doses available. And I'm wondering if you've heard anything from the state or if this is impacting, the second round for phase 1A or just getting into phase 1B at all.
Everything is changing pretty rapidly, both in Washington, D.C. and in Helena. We have received no indication that there's a problem with the second doses. We're still operating on the assumption that they'll be arriving and that we're going to be administering them. Anybody else?
Something in the chat for you, so just check that, but don't feel free to do with it what you will.
Oh, yeah. So I'll mention that. Thank you, Whitney. That was a reminder from Whitney. So just so you all know, if you haven't seen already, the governor had some decisions that he announced this week with regard to the statewide directives. The Board of Health is going to be meeting next week, kind of on the heels of the governor's announcement, to consider the local rules that are in place here. I want to start out by first acknowledging and respecting the governor's efforts to deal with the pandemic and to express our intention to work with the governor's team and the state health department to respond to the pandemic in the ways that prevent hospitalizations and deaths. That's what we all want. I think we need to acknowledge that and make sure that we're working together. And I'm going into this with that attitude. I've also been encouraged that the governor has acknowledged the important role of local boards of health and local health departments in dealing with this effort and providing services and making decisions at the local level based on input that we get locally. In Montana, state law makes local boards of health, they give local boards of health not just the option, but the duty to take steps to protect the public health. And one part of that, just one part of that in Gallatin County has been through a number of emergency rules. Those rules remain in place, and we expect businesses and individuals to follow the rules. Some of those rules expire next week on Wednesday. So the Board of Health is going to meet on Wednesday and consider 4 of those emergency rules, some of which expire on that day. At that meeting, the board will consider the best scientific evidence. They're going to look at the best current epidemiological data, and they're going to make some decisions about whether to extend or modify those rules. That will include the rule on business operations. It will include the mask rule here in Gallatin County. It will include the rule on long-term care facilities and isolation and quarantine. It's 4 rules. All of that information is uploaded on our website. Those rules are there. The notice of the meeting, the agenda is there. Will be, as well as the ability for people to have public comment. And we're going to move through this in a pretty methodical process. Again, the governor made some decisions at the state level. I think it's time for the board to make some decisions at the local level. They'll do that the same way they've done that in the past. They'll look at the best scientific evidence that we can find. They'll look at the best epidemiological data, and they'll make some decisions about the path we take going forward. And that meeting will happen Wednesday at 7 a.m. That's the day a couple of those rules expire.
Hey, Matt, it's Emma.
Hi, Emma.
Just follow-up question on that. I know you mentioned, obviously, right now in Montana, the local health board rules and directives still do trump anything coming from the state, but there was a bill, House Bill 181, presented that could, if passed, limit and slow that authority from the local health board. So are you looking at that at all? What is kind of your reaction and moving forward if that were to be passed?
We're watching what's happening in Helena, but honestly, I have my hands full here in Gallatin County. I did testify in one of those bills yesterday briefly. I think it's important that our voices are heard. Again, the legislature has the authority to make those decisions. I hope they take that really seriously, because whatever they decide is going to have a significant impact on our public health system. That's about all I have to say about it right now. I think our public health system in Montana and having local control, I want to point out, it's important people understand that local boards of health are appointed by local county commissions and local city commissions. In Gallatin County, every member of the Board of Health is appointed by either the Gallatin County Commission or the Bozeman City Commission. Every Board of Health in the state of Montana is set up by those elected bodies. The membership is determined by those elected bodies. Elected officials sit on those boards. They serve on those boards, and they have the discretion to decide who's on them and they have the discretion to take people off of them. They can decide how many people are on the board and how those boards are arrayed. So it's important that people understand there is already a great deal of local control, and that's held by elected officials on how local boards of health operate. Local boards of health are usually unnoticed. They do a lot of work every year, every month, every week of every year. They do work that doesn't get noticed by the vast majority of people. It's frankly pretty boring stuff for most people. It's septic variances, and it's prevention work, and it's stuff that people don't notice. And the people that sign up for boards do so because they want to use their expertise and their experience for public service. Nobody on any board of health anywhere in the state of Montana signed up thinking they were getting into a pandemic. And so they neither asked for or wanted to have these really difficult decisions cast on them, but that's where we are, and they know that that's their duty, and we're going to keep doing that duty. Now, if the legislature changes that, we'll live with that, and we'll respect that, and we'll keep trying our best to do our work.
Hey, Matt, I got a question from Perrin. She texted it to me. She wants to know if the county has reached out to everyone it knows of in phase 1A so far, and the number of people vaccinated in that 1A group so far as well.
Mike, you want to help me out with that? I think we've gotten to just about everybody. I think we've notified just about every organization that would fall into 1A, but maybe you're a little closer to that.
Yep. Mike Maltaverne serving as this week's incident commander to help Matt and the team at the health department. Yeah, we've pretty much reached out to everybody that we can, knowing that we probably have some stragglers that will be coming in that haven't been available over the last week or so. But for the most part, we are through that 1A list to our knowledge.
The important thing I would add to that is just to understand that when we move to 1B, that doesn't mean that people in 1A are no longer going to be eligible for the vaccine. As we get new healthcare providers, as we have people who may have missed it or for whatever reason, we'll continue to serve them. We do, obviously there's going to be many fewer of them, but just because we're moving to the next phase doesn't mean that people in 1A are going to lose that opportunity.
Yeah, and any idea on how many people were in that you vaccinated in that group so far?
I don't have the top of my head, but we can dig that up and have Whitney send it out.
Yeah, hold on.
Thank you.
A sec.
Patrick, are you getting that?
Yeah, hang on a
Okay.
second.
Okay, thanks.
And Matt and Freddie, I would just add to that. I mean, this is going to be an ongoing process for months and months, and not even just 1A, but as we move through all the phasing, to Matt's point, we'll always have the opportunity and the need to go back and touch people that we've missed, whether they be people that have traveled out of the area and they're back now, or like Matt said, employees that are coming and going through attrition and the like. So once we move further through those phases, we'll be bouncing back and forth and always kind of regressing back into those phases and picking up people that we've either missed or their employment has changed and the like. So the further we get, the more we'll be moving around in those phases.
Just so you guys know, we're working on a way to regularly update you guys on the number of vaccines that we're administering. So it'll likely be part of the surveillance report moving forward. We're just still logistically trying to figure that out. And, but we'll have that as part of the surveillance report on our website and on social media too. So you'll get a more regularly provided number of vaccines that we've received and we've distributed moving forward. So.
I thought I had the number handy. I don't.
We'll
have to get it to you guys.
Thank you, guys. We'll get that out. We've got that information. We just don't have it at our fingertips right now.
And Freddie, just to clarify, is she asking for the total number distributed just by the county, or does that include Bozeman Health and community health partners and that sort of thing as well, or just the county, the county doses?
She didn't specify. I'm assuming just for the county. I don't know if you guys would know all the other. So. Yeah.
All right, I'll send an email and parse that out for you guys.
Okay, thanks.
Thank you, Freddie.
That'd be nice to have too on this end as well.
It also occurs to me.
Group.
Sorry, I didn't mean to talk over you.
That's okay. I was just saying I'll send that out to the whole group, not just Freddie.
I did want to go back real quickly here. When we talk about on the surveillance report there, I think I skipped the last screen. Let me see if I can get back to it here. There it is. Skipped the last screen inadvertently. it just jarred my memory of the occupancy at Bozeman Health. That we're continuing to see a significant number of people in the hospital. What I want to talk about is these numbers really talk about the number of beds, and we're going to keep sharing that. What I want you all to understand that conversation is much more complex than just the number of beds that we have. We're in regular conversation with Bozeman Health. And we're looking, the number of COVID patients that we have at Bozeman Health right now is down pretty significantly from where it was in November when we were pushing 30 people in the hospital and really significant number of people in critical care. That situation has improved. But what's also happened over the last month, and it's predictable because it happens every year, is as the winter sets in and as the winter wears on, we get other illnesses and people need the hospital for other things. In talking to Bozeman Health over the course of the last week, they've been pushed, and it hasn't been by COVID patients, thankfully, but it's been by people who are in need of hospitalization in other places. And there have been days this past week when their occupancy in critical care has been at 100%, and where their overall census has been pushed pretty significantly just by the overall need in the community. What they tell us is they're used to that. They can manage that. They deal with that year to year. The thing that we're concerned about, and the thing that we're really working hard to avoid, is if they're in that situation at Bozeman Health or the hospital, and we have a surge of COVID on top of it, that sends a high number of people with COVID-19 into critical care, or even just the general census of the hospital, that makes their job all that much harder. That puts all that much more pressure on overall healthcare resources. That's something we're seeing happening in Southern California and Arizona and some other parts of the country. It's important that we understand that the situation is more fluid and more complex than just looking at the number of available hospital beds, or even just looking at the number of COVID-related hospitalizations. We need to consider the overall burden on the healthcare system and take into account that these winter months tend to be some of the busiest months for hospitals anyway. And so doing what we can to reduce the number of COVID hospitalizations is really important right now. I just wanted to get that out there because we hadn't hit that part of the surveillance report.
I have the numbers if people are ready.
No, I filibustered long enough to actually get the numbers. So.
Yeah, I had to do math. So this is broken out by agency, and this is how many actual doses have been sent to the county, not how many vaccines have been administered. Because as you all know, some of the Pfizer stuff, they've gotten 11 doses out of a 10-dose vial, and the same thing with the Moderna. So it's not how many have actually been administered, but it's how many doses have been allocated to Gallatin County. Community Health Partners has received 200. The Bozeman Deaconess Health System, so that includes the Big Sky Medical Center and the campus here, 2,475. Montana State University, 300. Gallatin County proper, 1,800. And you can use your calculators to figure out the total sum.
Patrick,
Yes.
I don't know if you're taking that from the COP. I don't think that includes what we did yesterday.
That should include yesterday.
It does?
Yes.
Okay.
I think so. Maybe it doesn't. Maybe we're short 500. Whitney will verify that for you. We might be short 500 on the Gallatin County one.
And we don't, just so you all know, we might have a few doses around, but I don't know that we have any left. We really tried to give out, we're trying to get the vaccine, we're trying to store the vaccine in people's arms, not in our freezers. So that's really, we don't have a lot at the county level. We don't have a lot. I know the hospital administers most of it as CHP and the NMSU.
I'm pretty sure Whitney's right now. I'm looking at the data of this. So Gallatin County would be 2,300.
Rather than 1,800.
Yep.
Hey, Matt, I had a question. I saw today the health department reported 118 new cases. That seems like a bit higher than it has been for a daily update. in a few days or a week or so. So I'm wondering if that's cause for concern for you at all.
Yeah, I try not to get too worked up about one day alone. I mean, we do watch it. We do pay attention to it for staffing. I pay attention to it related to how our staff is doing and whether or not we're able to get to cases. But we really want to pay attention. We're thinking about making decisions. We think about communicating. We want to make sure we're looking at that 7-day rolling average. Is that number the one that was on our website, or are you looking at the state number, Nora?
It's on your website.
Okay. So it really is going to fluctuate day to day, and that's why we do the 7-day rolling average. So yeah, it's concerning to have over 100 cases in a day, but I think it's important that we don't overreact to any one single day. We're seeing an increase. We're seeing a significant number of cases, and we're dealing with that, and we're hoping to see those numbers go down. Other questions? All right, folks, stay safe on the ice out there and elsewhere. And I appreciate your time, and we will be in touch again next week.